Hello to all, I am Dr. Vishnu. In this video, I am going to talk to you about Introduction to Pharmacology and some very important terminologies that you need to know under the common title General Pharmacology. So please make sure that you subscribe to my YouTube channel and also follow my Instagram page because I will be giving you, maybe trailers and important announcements in Instagram regarding my upcoming videos that I am planning to share with all of you. So please make sure that you stay tuned because the videos that I am going to share with you will be in PowerPoint backgrounds where I have made the slides of my own, and you can watch those slides in which I'll be speaking in the background so that you can learn in the process. If you have any doubts or if you have any queries, definitely contact me on my Instagram page. My phone number is also given in the same. So without wasting any time, let's get started. So in this episode, I'm going to talk to you about important terminologies and definitely an introduction to pharmacology. So this actually comes under general pharmacology, which I had announced that I will be starting with. Maybe day before yesterday, I had announced it on Doctor's Day. So without wasting any time, let's get started. And please make sure that if you get any important points which you feel like catchy or which can be good for your exam preparation, then you can note it down in the process as well, because this is a YouTube video, so you can access it anytime. The only favor that you need to do back is to subscribe and share it to maximum people, because knowledge shared is knowledge doubled. So without wasting any time, let's get started. So what is pharmacology? It is actually derived from a Greek word and it is divided into two, pharmakon and logos. Pharmakon means the active constituent or the drug, which is the active constituent, and logos means discourse. Discourse means root. So basically, pharmacology is actually a science that deals with the interaction of medication with the living system. So living system, why I said, is because we have animal pharmacology also, which comes under veterinary, and we have human pharmacology as well. So both come under pharmacology. So the interaction of medication or medications with the living system is called pharmacology. So if you look at the major branches of pharmacology, pharmacology is mainly divided into two. One is called pharmacokinetics and one is called pharmacodynamics. So please make sure when I take the topic clinical pharmacology, I will be talking about these two aspects in detail, because these two are very, very broad topics. So it will require multiple video lectures. So I will be making presentations on that and I will be sharing it with you in future YouTube videos to come. So pharmacokinetic means what the body does to the drug. Like for example, you have taken a drug and what is the body doing to it? Like for example, if the stomach acid is destroying a particular medication, or if the liver is over metabolizing certain medication, like for example, first pass metabolism happens with nitroglycerin. Nitroglycerin is actually a medication that is used for angina pectoris or chest pain. So that is why we usually prefer sublingual nitroglycerin in an acute episode of angina pectoris. So pharmacokinetic means what the body does to the drug. So basically kinetics can include four things. One is absorption, distribution, metabolism, and excretion. Actually, one more point should be there, and that is called route of administration. I will be taking a detailed class on route of administration in the next class. If there is an alteration in the kinetics, the dynamics will also automatically change. Like for example, propranolol is a non-selective beta blocker and it actually undergoes first pass metabolism. That means it gets rapidly metabolized by the liver. So the problem is the plasma drug concentration of propranolol is actually very, very low. So obviously, if the kinetics of propranolol change, then definitely the dynamics. Dynamics means pharmacological action. That will also change. So that is why kinetics is very, very important for proper dynamics to happen. Now let's come to pharmacodynamics. What the drug does to the body. So the drug has two effects in the body. Always remember, a drug is a poison. Always remember, a drug is a poison. It is poisonous in two ways. Number one, poisonous to the disease that is causing problem in our body, and poisonous to the normal physiology of our body. Like for example, paracetamol. Paracetamol is poisonous to the condition that is causing problem in our body. For example, fever or pain. But at the same time, if you are taking too much of paracetamol, it is poisonous to the liver as well because it causes hepatotoxicity. So pharmacodynamics means what the drug does to the body. So it actually includes mechanism of action and mechanism of side effect or adverse effect. Now, basically, pharmacological action. Now, please remember, this is actually a very, very important slide because many people struggle with remembering pharmacology easily because they don't understand this slide. This slide is literally very important. Pharmacological action of every medicine has to be understood first. Before you go into all the other details of a medicine, you should understand pharmacological action. And the biggest reason why we forget side effects or adverse effects and we end up writing nausea, vomiting, and diarrhea in the examination paper is because we do not understand the mechanism by which the particular adverse or side effect occurs. So pharmacological action is divided into two. One is called the mechanism of action and the other is called mechanism of adverse or side effect. Mechanism of action means how does the drug cause beneficial effect in the body? Like for example, you have taken metformin for diabetes. So how does metformin help in diabetes? So metformin, it goes into the body, it improves glucose utilization, it also reduces hepatic gluconeogenesis, so that improves insulin resistance in type 2 diabetes mellitus. Metformin goes into the body, it improves glucose utilization, so that makes you energetic, and since it makes you energetic, it can cause anorexia as a side effect, and this anorexia leads to weight loss, which is actually good for females who are suffering from PCOD with obesity. So this is called mechanism of action. Now coming to mechanism of adverse or side effect, it means how does the drug cause harmful effects in the body. So for example, metformin goes into the body, it inhibits the reabsorption of vitamin B12. Now, vitamin B12 is actually very important for healthy hair growth other than biotin. And obviously, it is very important for your memory and smooth functioning of your nerves. So when vitamin B12 deficiency occurs, it can lead to long-term neuropathy and hair loss. So this is the mechanism of side effect or adverse effect. What we do is we simply study hair loss or peripheral neuropathy. After that, we do not know why hair loss occurs and why peripheral neuropathy occurs. So this slide is very important. This is also another slide which is equally important, and that is the difference between adverse effect and side effect. Many people confuse between both of them, and in many books also we see that adverse effect is mixed with side effect. Both are actually different. Side effect means it is the pharmacological action of a medicine which is always positive and negative, which is both positive and negative. And adverse effect is the pharmacological action of a medicine that is always negative. It can never be positive. A simple difference. You may find other terminologies, you can add other things that you want, but this is one of the simplest definitions that can be presented in front of you. Pharmacological action of a medicine that can be both positive and negative is called side effect. Pharmacological action of a medicine that is always negative is called adverse effect. For example, now let's come to the example of side effect. Metformin causes weight loss. So it is not good for some people, especially if the person is already thin. Metformin will not be good for that person. So it is a negative effect. But if it is a patient who is obese, for that person, metformin is good because it causes weight loss. So that is why weight loss is actually good for females who are having PCOD with obesity. And that is why we use metformin in such patients. For example, acetazolamide, which is a carbonic anhydrase inhibitor, it causes metabolic acidosis as a side effect because it actually increases the elimination of bicarbonate through the urine. So when bicarbonate gets eliminated, it causes metabolic acidosis. So this can be used in the treatment of metabolic alkalosis. For example, thiazide diuretics, loop diuretics, they usually cause metabolic alkalosis. So in those patients, we can use acetazolamide. So this is the example of side effect in which the pharmacological action can be positive to some people and negative to some people. Now, if you look at the adverse effect examples, valproic acid, this is usually used in the treatment of epilepsy. It causes hepatotoxicity. If you look at my reel on Instagram, I have talked about a drug interaction of valproic acid in which I have mentioned about a hepatotoxic metabolite that valproic acid generates. So, for example, valproic acid causes hepatotoxicity. So how can you say that it is a side effect? Do you want liver damage to happen in some other patients? Do you want somebody's liver to get damaged? No. So that is why this is an adverse effect. Propranolol causes bronchospasm because it is a non-selective beta blocker, and you know very well that beta-2 receptors are found usually cause bronchodilation. So propranolol, by blocking beta-2 receptors, it can cause bronchoconstriction or bronchospasm. So do you want bronchospasm to happen in some patients? No. So that is why this is known as adverse effect. Now let's come to therapeutics. It is also known as pharmacotherapeutics. So when you are applying pharmacology in a clinical scenario, now pharmacology, whatever you study in the book, it is theoretical knowledge. When you are applying that in a particular patient or in a set of patients in the treatment of clinical cases, then it is called therapeutics. So there is an equation. This is an equation that I generated on my own. This is an equation to remember therapeutics easily. Therapeutics is equal to triple P plus D. P stands for pathophysiology. P stands for pharmacology. Another P stands for patient counseling. That is drug and disease oriented. Like, for example, should you take the medicine before food? Should you take it after food? Should you take it with food? What are the things that you should take care of when you are suffering from a disease, etc., etc. And definitely D stands for diagnosis. So this entire package of triple P plus D is known as therapeutics. Toxicology, it is the science of study of poisons, their action in the body and treatment strategies. So toxicology is actually an extension of pharmacology. That is why I've seen actually some people, they get confused with adverse effects and toxic effects. They say both of them are the same. No. Toxic effect only happens when you overdose on a particular medication. If some negative thing happens due to a medication at a normal dose, it is called an adverse effect or side effect. But if something negative happens to a patient due to an overdose, it is called a toxic effect. Like, for example, you have taken 15 to 20 tablets of paracetamol and you got hepatotoxicity. So that is overdose. Obviously, no one will give you 15 to 20 tablets to eat per day, and that too at the same time. So that is a toxic effect. So if you overdose on the medication, the pharmacological action gets converted into toxicological actions. So for example, paracetamol in overdose causes hepatotoxicity, and the antidote for paracetamol poisoning is N-acetylcysteine. We have methionine also, but mainly we give N-acetylcysteine. Now let's come to chemotherapy. So this is actually a science involved in the effect of drugs on microorganisms. So it is known as antimicrobial chemotherapy. And then cancer cells, it is known as anti-cancer chemotherapy. Now we come to clinical pharmacology. So it basically involves the clinical use of medication, their potency, their doses, toxicity, clinical trials also. Like, for example, there are different phases of clinical trials: phase 0, phase 1, phase 2, phase 3, phase 4. So what is happening for a particular medication in different... I'll come to all these topics later. And obviously, rational drug use. This is very, very important. You cannot simply give a medication to a patient. You have to see whether based on the age of the patient, based on other comorbidities, and cost of the medicine, the particular medication is good or not. Pharmacoepidemiology. Pharmacoepidemiology means it is the study of effects of drug on population. It is the study of effects of drugs on population. Like, for example, the effect of carbamazepine on pregnant population. Carbamazepine actually should not be used in pregnancy because of the risk of spina bifida. Effects of tetracycline on pediatric populations, especially if it is used below the age of 7 or 8 or something, then tetracyclines, they can actually cause problems with your teeth or problems with the normal growth of bones. Effects of anticholinergics in the elderly. Anticholinergics, they usually cause sedation. So in the elderly, you know very well that if they are sedated, already the elderly means it is a fragile population. And if you are using anticholinergics for a long term, then there is a risk of falls and subsequent fractures. Effects of benzodiazepines in lactating females. So benzodiazepines may get excreted through the breast milk. So if the baby gets exposed to that, you know very well what can happen. Now we come to pharmacoeconomics. So pharmacoeconomics is actually the study of identification, measurement, and comparison of cost, risk, and benefit of therapy. So basically, pharmacoeconomic means you are trying to balance the efficacy of a medicine with the cost of a medicine. So your motive should be that the medicine should be cost effective, and at the same time, the medicine should be rational in the particular patient. So it should not be too costly, nor it should be less effective. So when you try to keep a balance between the cost and the effect of a medicine, that is called pharmacoeconomics. So it basically helps to identify which alternative produces the best clinical outcome for the money invested. That means you are giving 10 rupees for a medicine. That medicine should be effective for that 10 rupees. Now let's come to pharmacogenetics. This is very important because there are a lot of people who actually respond to certain medications much more severely than the normal population. So that is actually due to the variation in our genes. So this is actually the study of genetic variation that gives rise to different responses to drugs among individuals. So different populations, so that depends on different genetic populations. Like we have different races, right? We have Afro-Americans, we have Asian population, we have different types of races. Like for example, if you have CYP2C9 mutation, clopidogrel, which is an antiplatelet, will not work properly. So if clopidogrel doesn't work properly, its antiplatelet activity will get reduced. And if its antiplatelet activity gets reduced, it will increase the risk of thrombosis in that population. Why? Because clopidogrel is an antiplatelet. Antiplatelet means it is preventing thrombosis. So if you are having CYP2C9 mutation, clopidogrel will not work properly. If you have HLA-B1502 variation, and if such patients are using carbamazepine, carbamazepine is actually a medicine used for epilepsy, and it is also used for trigeminal neuralgia. So if you are having HLA-B1502 variation, and if you are using carbamazepine, it can cause life-threatening Stevens-Johnson syndrome and toxic epidermal necrolysis. So this is called pharmacogenetics. I will be talking about all these things because there are so many videos and so many reels that I have in plan. I'll be talking about this in future days to come. Now let's talk about pharmacogenomics. So this is the study of application of genomic technologies for drug discovery and further characterization of older drugs. Pharmacognosy is the study of drugs which is derived from plant origins, how it is synthesized, how it is purified, what are its constituents, and what are its uses. Pharmacy is actually the science of compounding and preparing suitable dosage forms so that it can be administered in man and animals. So it actually indicates purification and synthesis of the formulation and the medication, standardization, and definitely quality control. Because if the quality is not proper, no matter how many prescriptions you write, if the quality of the medicine is not proper, then definitely it will never ever work in the patient. So quality control is very important. Clinical pharmacy or clinical pharmacist. In fact, the role of clinical pharmacist in our country and definitely in abroad, it is recognized, and it has to be recognized on a better scale. Clinical pharmacy is the branch of health science in which pharmacists provide patient care. Now, what do you mean by providing patient care? So look at the roles of a clinical pharmacist: assuring rational use of medication. For example, why meropenem has been given to that patient? Why not ceftriaxone? Why not piperacillin tazobactam? Why is it meropenem? Why are you giving that particular medicine? Why can't you choose better alternatives? So that is called rational use of medication. And obviously the dosage adjustment, all these things also come under it. Reducing the burden on physicians on optimizing treatment strategies. Now, for example, it is a surgeon. Now, for a surgeon, it is very challenging because the job of a surgeon is very challenging. Because if you are not operating properly, then something else will happen to the patient. So already you have a huge burden on you. And then when the patient is shifted to the ward or the ICU based on the surgery, performed, you have an additional burden that you have to treat the patient with other medications. So you already have a burden of diagnosis, then you have to perform the surgery or whatever procedure it is, and then the pharmacotherapeutic burden also comes. So here comes the role of a clinical pharmacist who makes sure that the pharmacotherapeutic burden on physicians or clinicians is reduced. So for example, there have been a lot of cases in which clinical pharmacists have played a huge role in making sure that drug interactions are reduced to the best way possible. Adverse effects are reduced by proper monitoring parameters, and a lot of interventions have also been made. So basically, a clinical pharmacist is an integral part of a healthcare team. Pharmacovigilance. So this is actually the science of monitoring, detection, and reporting of ADR. So basically, I'll come with a detailed class on pharmacovigilance in which you will understand what are the different types of ADR, what are the different types of adverse drug reactions, how to report them to WHO and different regulatory bodies, etc., etc. I'll be coming with a video on that. Pharmacopoeia. So it is an official reference that contains a selected list of established drugs and medicinal preparations. So it actually includes quality test, purity and potency, storage condition, because every medicine, have their own quality assurance test. Their synthesis is different and they have to be stored in different conditions. So all these things are compiled or collected in a book known as Pharmacopoeia. So we have, in our country, we have Indian Pharmacopoeia, we have British Pharmacopoeia, we have United States Pharmacopoeia, etc. National Formulary. So this is actually a compilation of drugs that have been recognized as legal standards of purity, quality, and strength by the government of that particular country or healthcare system. So for India, we have National Formulary of India, that is NFI. And for the British, they have British National Formulary, which short form is BNF. Orphan drugs. So these are actually mainly indicated for rare diseases. Very rare diseases because the drugs itself have been discovered or are actually under trial for this rare condition. So that is why its indication is also very low. For example, miglustat for type 1 Gaucher disease, which is actually rare. Iloprost for pulmonary artery hypertension. So for example, it is for New York Heart Association, maybe class 3 or 4 type patients. pegvisomant for acromegaly. I'll talk about all these medications later, so don't worry. So this is just an introduction into pharmacology and some important terms that you need to know, so that this not only helps with your theoretical knowledge and smart learning, but when you are in a clinical scenario also, these terms will be helpful for you when you are interacting with patients, when you are interacting with other healthcare professionals, and you are dealing with challenging scenarios. So I hope this video was informative for you. I hope you have got to learn smart from this video. Some terminologies and some examples also I have mentioned here, which have definitely might have caught your attention. So I will be coming with future videos also, in which I'll be talking about absorption, distribution, metabolism, excretion, and a lot of other amazing pharma videos are waiting for you. So please make sure that you subscribe to my YouTube channel and follow my Instagram page for more amazing updates. That's all for now. See you in the next video. Until then, it's bye.